Welcome, everyone. Thank you for coming out today. I want to start with a land acknowledgement. Today, we're gathered on the treaty and traditional territory of the Haudenosaunee, the Wendat, and the Anishinaabe First Nations, and the Mississaugas of the Credit First Nations. These lands are protected by the Dish with One Spoon Wampum Agreement. Hello, everyone. My name is Justin Kong, and I am your NDP candidate for Scarborough North. We're so excited to have here today to connect with folks throughout the campaign. What we're hearing is people are tired. They're tired of governments talking a good game but not delivering when our communities need it most. Campaign after campaign, the Liberals and the Conservatives have said they would make life more affordable for our families, make things better, but things just aren't getting better. People in Scarborough are sick and tired, but they trust in Andrea. They know that with Andrea, they have someone that will fix what matters most to our families. They know Andrea listens. Andrea cares because they've seen that her priorities are our priorities during and after the elections. Andrea's priorities are mine, all of ours. They're our communities, and she will fight for us. I'm proud here to stand with her. And in 28 days, here's the next Premier of Ontario, Andrea Horwath.
Thank you so much, Justin. It's great to be here in Scarborough North with you and with some folks who are with us to talk about the fact that folks need dental care. Dental care is health care. But why is it costing people so much? With the NDP, you can get the dental care that you need at no cost. That's what people need. They need to be able to have that dental care. You know, parents want their kids to be able to be happy, to be able to be healthy. But when it comes to their dental care, it costs a lot of money to go to the dentist. It's expensive. We can make sure that all families are able to access the dental care they need. You know, especially these days, things are really getting out of hand. Folks need a break, and our plan will give them that break. It'll make sure that, for example, a family of 4 can go for a year and have all of the checkups they need, maybe a cavity filled, and it'll, right now, cost about $1,200. Well, we'll make sure that that money is no longer coming out of your pocket, that you'll be able to access that care without having to open your wallet. Similarly, if your children, say you have a couple of kids and they both need braces, that costs the family $13,000 a year. That's a lot of money. Well, we can help make sure that you don't have to pay that money and your kids can get the braces they need. Right now, parents are making really, really tough choices. And what we want to do is relieve that burden. Imagine if you're a parent and you have to put off the trip to the dentist for the checkup because you can't afford it, or you have to delay your kids getting their fillings because it's just not in the budget. We can make sure that those awful choices that parents have to make are no longer necessary. With the NDP, your dental care will be covered. I want to end off by saying this. We can get this done, but in order to do that, we can get it done together, but in order to do that, job number 1, the first thing we have to do is defeat Doug Ford. Defeat Doug Ford and make sure people have access to the dental care that they need. People have had a premier who looks after his buddies, puts his buddies first. It's time for a premier that puts you first. I'm excited, really excited about this announcement, and I'll certainly take any questions that folks might have.
So we'll just ask journalists to line up at the mic. It'll be 1 question, 1 follow-up. First question comes from Charlie Pinkerton from Queen's Park Briefing.
Hey,
Hi,
Charlie. Andrea. I'm wondering, this isn't related to this announcement, but in terms of the larger campaign, your party's already released its platform. We're waiting for a costed platform. We know there's a debate coming up. What are the key moments for you that you think can really shake things up and help you improve your standing towards Election Day?
We just had a key moment a second ago when all those kids were on the corner welcoming us to the press conference. For me, that's what it's all about. It's about making sure people know that they have a choice, that this time we can come together and we can defeat Doug Ford and make sure that the things that are most important to people, the things that people are most determined to have happen is what our focus is going to be. For me, it's all about people. It's about making life better for folks, and we can do that, but we have to defeat Doug Ford first.
But can you be more specific? Like, are there different policy announcements you're looking forward to trying to win voters over on, or is it the debate that's coming up, or is it just this day-to-day stuff specifically?
Yes, it's a good question insofar as we know that campaigns matter, but campaigns are obviously made up of a whole bunch of different things, and I can tell you I have strategists that are doing some of that work, as all campaigns will have. But my focus as the leader of Ontario's NDP is to show the people of this province that together we can prioritize the things that matter most to them and deliver things that help relieve the financial pressure, like dental care, which costs so much money but is actually should be part of our healthcare system. And we're going to get that to happen. We're going to make that happen.
Next question comes from Siobhan Morris from CTV.
Hi, Andrea.
Hi, Siobhan.
I just wanted to make sure, this plan that you're proposing, is it fundamentally different in any way from the federal NDP Liberal plan, other than delivering the same program sooner?
So there are similarities, but what we're going to do is get to this immediately, and we're going to make sure that within the first year, by the end of this year, we'll have this plan up and running for families of households of $90,000 or less. You'll be completely covered, and then within 2 years, we're going to make sure that families under 2,000, like up to 200,000, will on a sliding scale also be covered. So it'll be implemented very quickly. I think the eligibility is a little bit different with the federal plan, but we know how hard families struggle and we know how high the cost of living is. So that's why the numbers are a little bit different. But we will implement this plan right away. And then when the federal plan kicks in, it'll reduce Ontario's costs.
This is, not a dissimilar question from when we talked about the tax freeze last week. Do people who earn $200,000 a year really need help on this front?
Well, between the 90 and 200,000, it'll be on a sliding scale. And when we get to the top of that scale, what we're telling folks in our plan and what we're committing to Ontarians is that it won't be any more than 50% of the cost. And so as you get up to that 200,000 household income, you won't be paying any more than 50%, but it will be a sliding scale between 90 and 200.
Next question comes from Holly Mackenzie-Suter from the Canadian Press.
Hi, Andrea.
Hi, Holly.
I'm just wondering about the cost, because you mentioned when the federal plan kicks in, it will lower Ontario's costs. Like, does that, are you going to need any federal money, I guess, to run this plan in the meantime? And
No.
I'm wondering, like, how much are you planning to spend, and how much are the costs going to be reduced by?
Sure. No, it's a great question, Holly. We've costed our plan at an initial outlay of $680 million. And then by the time the federal plan is fully kicked in, that'll bring our costs down to $380 million. So Ontario will always contribute because our plan is enhanced considering, or in comparison with the federal plan.
Great. And I was wondering as well about the plan to cut class sizes and hire more teachers, that the Liberals are proposing that as well. That's, just two promises that are very similar between your platforms. So if Doug Ford wins a minority government, would you work with the Liberals to form a coalition or some sort of confidence and supply agreement?
Well, what I can say is no matter what Stephen Del Duca says now, he had 15 years to make sure we had smaller class sizes, and the Liberals refused to do it. They had 15 years to pay attention to our public education system, but instead they didn't do that work. And now, he can say whatever he likes, but that's not what we've seen with the Liberals. My commitment is to work every day during this campaign and then as Premier to make sure that we actually prioritize our kids, our public education system, reduce classroom sizes, and ensure that every child has access to great public education that not only meets their needs, but to ensure that they thrive, and that ensures that they thrive, find their gifts, and succeed in life.
Next question comes from Lorenda Redekop from CBC.
Hi, Lorenda.
Just want to make sure that I'm clear. So for the people who will be receiving the free dental care, like who will the money go to? Because I've heard concerns about access, even when plans like this come into place.
Well, we have not only the the access in terms of regular dentists, and in fact, I just talked to a guy yesterday. It's funny you asked this question. I just talked to a fellow yesterday who said his wife is a dentist here in Scarborough, and because people don't have coverage, they come desperate. And she, the dentist, she does the work and takes for a payment whatever they can afford, and sometimes nothing at all, because she just feels a professional obligation to help people with the dental care that they need. So we're going to fix that. We're going to make sure that those families are able to get that dental care, and that the dentists are going to be able to be provided the funding to provide those services. But we're also going to put some infrastructure in place in community health centers, for example. Lots of folks are more comfortable getting their services at community health centers. So we're going to be increasing access there, 70 more units of dental chairs to be put into those community health centers, as well as dental buses, because again, rural Ontario, some of the remote communities in Ontario's north, there's not a lot of access to infrastructure for dental care, and so the dental buses will help fill that gap as well. So there's kind of a number of different ways.
Follow up, sort of an odd question. What's the significance of being outside this home in Scarborough?
Well, we're outside the home of a young woman named Annie, who I was first introduced to a couple of days ago. And Annie told me the story about what her family had to go through to be able to help her with her dental needs. She had a condition, folks might have heard of it before, where your baby teeth don't fall out, but your adult teeth start coming in, and that causes a lot of pain, but it also is very, very expensive, because then you have to have those teeth removed. The baby teeth have to be pulled, and that costs a lot of money, and it costed her family a lot of money that they really didn't have. Now, of course, with the history of her dental situation, she needs braces, and it's really expensive, and she can't afford them. So Annie's a really great example of how a dental plan like the Ontario dental plan that the NDP is committing to would help Annie not only when she was younger, it would have helped her and her family, but would help her right now to be able to afford the braces she needs.
Okay, we'll move to any questions on Zoom. If you do have a question, please use the raise hand function, and we'll let you know when you can go ahead. We have some written questions from Chris Rishowi. Where is the funding for dental care coming from?
Well, Chris, as you know, we are committed to making sure life is less expensive for families. People need a break, and this is one of those things that not only is going to help families to take pressure off of their pocketbooks, but it's also going to make a difference in terms of our costs on the access to care that happens now. Right now, every 9 minutes, somebody is attending an emergency room in our province to get dental care. That shouldn't be happening. So we're going to take the pressure off the emergency wards when we implement this plan, as well as provide people with the care that they need, the dental care that they need, without forcing them to pay exorbitant amounts of money that they simply can't afford. We will have, of course, as you know, our costed plan out completely shortly, but there's just no doubt in my mind that this is the right plan for Ontarians. This is exactly the kind of thing that Ontario families need, whether you're a senior, because let's face it, something like 61% of seniors don't have access to dental care. 1 in 4 Ontarians don't have any dental care. When you think about young workers, workers in the gig economy, none of those folks have access to dental care, or perhaps I should say very few would have access to dental care. And dental care is health care.
Okay, so I think you've already addressed Chris's follow-up, which was when can we expect the fully costed platform? So we'll move next to Dustin Cook from the Globe and Mail.
Hi, Dustin.
Hi, Andrea. Can you hear me okay?
Absolutely.
Great. Thanks for taking my question. I'm wondering, so this plan sets the threshold for middle income at $200,000 per household, but per household, and your tax freeze plan is $200,000 per person. Can you signify why the difference here?
Well, when we're talking about the access to dental care, we wanted to make sure that we are talking about households and families. But the bottom line is life's getting expensive for everyone. And the more pressure that we can take off of middle class and low income families, the better. That's why we've made the commitment not to increase taxes on middle income families or low income families. The other thing is that as we've done our research preparing our plan, the data shows that most families or most households with incomes over 200,000 already have significant coverage. However, if we do find, after putting our plan in place, that there is still a gap, that there are still people that are not getting access to dental care because they can't afford it, then we will certainly fill that gap.
Thank you. And follow up, have you spoken to the federal government at all about this plan? Any concern about stepping on their toes?
Oh, not at all. As you may recall, this was a plan that we came out with in our last election campaign in 2018, and I was thrilled. I was thrilled that Jagmeet Singh, the federal NDP leader, worked with Justin Trudeau to come up with the federal commitment around dental care. But we don't want people to wait. We want people to be able to get that care as soon as possible and to be able to afford to get to the dentist as soon as possible. We all know if we let things wait for too long, especially with dental care, not only do we end up in a lot of pain, but there's also other health consequences that can flow from that. And so we want to get this done as soon as possible. You know, just yesterday, when I was in a different part of this community, a different part of Scarborough, I was talking to a woman, actually. You know what? It was not in Scarborough. Now that I think about it, it was when we were in Pickering. And I was talking to a woman who literally told me, and she had no idea we were making this announcement today, that she had an abscess tooth for 3 years. For 3 years, she used various kinds of pain medication, knowing that this abscess was getting worse and worse. She couldn't afford to go to the dentist, and she confessed to me that she was waiting until it got so bad that they would be able to take care of it in an emergency room. Nobody should be making those kinds of choices and decisions. People should be getting the dental care that they need when they need it, and our plan will make sure they do exactly that.
Seeing no further questions, I'll turn it back to you, Andrea.
Thanks. Sure, go ahead.
I was wondering about, are you planning to try to negotiate with the federal government to get them to pay more money to, if you do form government, wouldn't it be ideal to see if they would speed up the funding?
Sure, absolutely. But what I'm committing to Ontarians is we're not going to wait. Oftentimes these programs take a long time from the federal side to get on the ground. And we don't think people have that time in Ontario. I know that people can't wait. So we're going to start, and as the federal government puts their program in place, we'll fold it into our program.
But you would try to open talks to see.
We'll always fight for what's best for Ontarians and try to get as much as possible in terms of contributions, resources from the federal government for healthcare, because it is a joint responsibility.
Sorry, may I ask one other thing along those lines too?
Sure.
Just I'm scrunched over on this little mic. The supply and confidence agreement that is bringing this into place federally, if that falls apart and does not follow through, and your party is in government here in Ontario, will you dedicate more funding to ensure that your plan here comes to be independent of any federal funding?
Absolutely. It's a great question, Charlie, and it's something I'm totally committed to. That's why I started talking about it far before the federal government made their announcement. It is something I think is extremely important. Look, why do we know that health care for the rest of our bodies is important, but somehow we leave out the mouth? It doesn't make any sense. So I would hope that doesn't happen, but if it does, I'm committing to Ontarians that we are going to make sure they're covered. With Ontario's NDP at the helm, you will have your dental care covered.
Thanks. That's all the time we have for questions. So I'll turn it back to you, Andrea.
All right, thanks, Michelle. I'm really glad to be here. Annie, thank you for sharing your story with us and allowing me to publicly share your story with Ontarians. It really does show how important dental care coverage is because it is healthcare. And you're a very brave young woman for being with us this morning, and for the other folks behind us as well. Seniors are another group of people that really, really need dental care. And as I said, together we can get that happening for seniors, for young people, for young workers, for families, for everybody that needs it. But the first job is to defeat Doug Ford and make sure we have a premier that prioritizes you instead of his buddies. Thanks, Justin Kong. Thank you, Justin Kong, for being here with us, and have a great time on the campaign trail. You'll do well. Thank you.